Welcome to another edition of Keeping It Local with Kim. Today, I have the opportunity to interview Jaimal St. John of St. John Sports and Medical Massage and practicing at Woodlands Chiropractic. It's going to be an educational, informative, and a little bit entertaining interview. So without further ado, let us welcome Jaimal St. John and begin the interview. Welcome, Jay. Can I call you Jay?
Yes, you can.
I believe my introduction did you a great injustice because I didn't fully explain your background and credentials, and I really would like for you to go further into that and share with the community more fully about yourself.
Sure. Well, I come from a big history when it comes to the world of massage. My father is actually quite famous. He was one of the pioneers in his method in neuromuscular therapy. And then we're going to get talking into neurosomatic therapy, which is probably the most comprehensive form of deep tissue massage, sports and medical massage that there is. I grew up around it. I watched all of my father's videotapes and read all of his manuals. Every single time I got treated by him and others around me in his sphere and of an influence in his world, I paid attention. I always had a love for it. But he finally opened up the Center for Neurosomatic Studies, probably one of the top massage schools that there are out there. Easily 3 times the amount of required curriculum than most other massage schools out there. Went to the school and I've been in private practice ever since, and also work at other places as an independent contractor, so in the family, and so I do that as well. So that's kind of a quick background for you.
What exactly is neurosomatic therapy, and how does it differ from regular massage and maybe even physical therapy?
I briefly said neurosomatic therapy is probably the most comprehensive form of sports and medical massage, but you're right. What does that mean? It incorporates what other massage therapists don't do, which is structural assessment. When I say structure, I'm talking about the skeletal system. That's why we tend to see us work with chiropractors by assessing the skeletal system. We are able to tell where the dysfunction is in the muscular system, which is what we do, because muscles move bones. Bones don't move muscles. And so we have, my father actually created a posturology chart. It's an 84-point postural assessment. When you do it, it tells where the body is in distortion, the alignments of the body on 3 different planes. When we visually look at you, standing up, or when you're lying down, in what we call a supine position on the massage table, we run assessments. And so that's a number one building block for neurosomatic therapy that differs from regular massage, and that a lot of the times when a patient comes in and they try and explain where their pain is coming from, they'll just point to mainly what we call local pain instead of referral pain. They don't know where the pain is coming from. It's just where the most amount of pain is. They point right there. It could be coming from structural abnormalities, or it could be coming in from weak or inhibited muscles or in tight muscles that are in different places, and it just, the pain and dysfunction manifests in a certain location. So we're experts in figuring out not only where the main problem is coming from, but then developing a protocol for each individual patient based on their structural abnormalities. So the first 3 months actually of every single student's education is that posturology chart, learning where to find pain and dysfunction. When people come to us, it's less about the dim lights, the candles, the incense. It is, you would come in, you put a certain kind of, well, not a gown, but an outfit on that makes it easy for the client to move on the table and get in certain positions that we need in order to get to some muscles that, quite frankly, a lot of massage therapists don't know how to treat or would never treat in their practice. They don't even put their patients in, a sideline position a lot. Normally, it's just face up supine or face down prone is what we call it. They'll flip over through somewhere in the middle of the treatment. It's very treating those muscles and how they treat is very what we call superficial. So they won't go to the deepest levels, muscles in the body, say the deep hip flexors. They may not even treat the glute muscles or get permission from their patient to treat those, and they may not know or even treat the muscles underneath them or know the importance of those muscles. So the organs are muscles as well, and they can go into spasm. So we're trained to treat them. We can realign cranial bones. We found that's actually one of my favorite things to do. Is we found that a lot of people go to, say, the dentist for jaw problems, and if their cranial bones are misplaced, especially the temple bones, which is right next to the TMJ joint, you might find that people go grinding down their teeth at the dentist, and all they really need to do was come in and I'll slap on gloves. I'll work intraorally the muscles of mastication, the muscles that would affect the retracting, the opening of your jaw and your mandible, and then realign your cranial bones. Work with your cervical C1, C2, because those three things, the cranial bones, the TMJ, and the alignment of mainly the first and second cervical vertebrae, are almost always work together and go into distortion with one another. And that's just one of many, many, many examples that neurosomatic therapists incorporate and know what to do in order to bring balance to the body that just, quite frankly, gets missed in the world of massage therapy for sure, but is also not even included in chiropractic work.
Speaking of chiropractors,
Mm-hmm.
I was very grateful when I first met Dr. Myers of Woodlands Chiropractic, and then it was complete icing on the cake when Dr. Myers then referred me to you for treatment, and I've just been amazed at the high level quality work. So my question is, for the community, how does your work coincide with the chiropractor's work?
If the massage therapist and the chiropractor don't have an understanding and they don't work well together when it comes to each individual patient and implement their talents together for that one patient, well, then it's just private practices under one roof instead of two roofs. And I think what I like about working with Dr. Myers is that I can say, for this patient needs more chiropractic, say, than massage, because ideally the theory is that in an ideal world, you get treated by a neurosomatic therapist first. They loosen they run a structural assessment. They treat all the muscles that are indicated for that patient's distortions, loosen everything up, and then you're prime prepped and ready to go into the room. I talk to the doctor and I say, this is what I worked and why. This is what I saw. Now, he then does a session with you specifically designed to bring you back in alignment. So in layman's term, if you go into our office or pretty much any chiropractic office, they should have charts on the wall of the muscular system, the skeletal system. I have charts of all the systems in the body, but those are the two main ones. And if you look at both of those charts, they're what we call anatomically perfect. And so the muscles are perfectly balanced from one side of the body to the other on what we call the mid-sagittal planes. If you look at our body is basically cut in half. We have the same bones and muscles over here that we have same bones and muscles over here. And the idea is to balance your body on all planes. So if the goal is to bring symmetry when you're looking at a person, I might look at I'll give you an example. I might be running my assessments and look at a patient and one shoulder is lower like this. Well, then they're not going to walk with their head in alignment with their shoulder. They're going to contract muscles over here to bring their head back in alignment. They a person might walk and they've got a muscle that's, a tight hip flexor, and it causes rotation in their pelvis. They might contract muscles in their back on the right-hand side to twist their spine back straight so they can walk straight, not in alignment with their pelvis rotated. So the goal is to see a patient, treat a patient, to get them to look like those charts. General rule of thumb is if a patient is, we run all of our postural assessments and there's all these neutral lines and on all planes, and we've got them looking like those anatomically perfect charts, well, then that person is probably going to be live a life pain-free and not be in dysfunction. And so that's our goal. And we've broken it down into a very systematic way of doing it that is really important and is not really done out there in the world much. Normally, you'll see modalities just stick to themselves. You got chiropractors have their own practices, massage therapists have their own practices, acupuncturists might have their own practices, just separate practices all over the place. But more and more, some of those different practices are getting together and saying, you know what, it's not enough that you do a massage treatment and then you refer someone to a chiropractor long after gravity sets in, or they go about their daily lives, and a week later they may get a chiropractic adjustment. So we do a very good job of right then and there getting together, putting together a treatment plan, doing it very systematic, protocols in place. Go to this room, then you go to that room, get on this machine, utilize these different kinds of medical devices that we use. We should probably talk about that as well. Dr. Meyer's clinic is pretty well stacked, and I bring as well some very incredible, amazing medical devices that help us in our treatment. You can attest to that. I use some stuff in our. It's not just my hands. It's not just treatment, and that's all bundled together in one cost, not padded and more money. As a matter of fact, I think our costs are some of the cheapest out there. So the patients that come in are getting incredible value. But we just go above and beyond. What we're putting together there and growing should be a model for other practices.
What are some of the medical devices that you use, that you implement in your treatment?
I use something called a beamer. It stands for bioelectrical magnetic energy regulator. It's a very expensive piece of equipment. I think it's about $6,000-7,000 with all the applicators. It's probably the number one device for blood flow, blood regulation, cell regeneration, cell hydration. That there is out there. It was created by a scientist, a German scientist. My dad likes to say he's got a few neurons to rub together. His name is Dr. Klopp. He's got like 4 PhDs. The German government is on the hook for their their health insurance, and so they have every incentive to get people well. And this device is actually used in a lot of hospitals over in Germany. It's becoming more and more popular, more well known in Europe. It's trying to make its way over here into the United States. Lots of athletes are using it. It's helping them prolong their some of them their illustrious careers. I know Roger Federer, one of the greatest tennis players of all time, uses it. Lots and lots of athletes. I can attest to it. I had a very bad accident where I had a concussion and a whiplash, 2 shoulder surgeries from it. It really does an incredible job with calming and stabilizing the nervous system. And that's very important. The nervous system and blood flow is very important to a really good neurosomatic therapist and chiropractors. As a matter of fact, chiropractors claim to fame is that they relieve the pressure and help keep the neural pathways of the nervous system uninhibited. I would agree with that. The muscular system as well. A muscle that's in spasm can entrap nerves all throughout the body. This device helps with that. It helps. This is a very generic term, but it helps relax the patient. But it is working far beyond that before we even start our treatment. My father turned it on to me, and he incorporated it with all of his patients once he saw it work with some people that have some of the worst debilitating diseases and pathologies you can find. So quadriplegics, ALS patients. I've had great success with some of my ALS patients, stroke patients, people that have had really bad eyesight are using what's called a B spot. Looks like a hockey puck. What you're accustomed to is the B pad. It's a mat that looks like and runs the whole length of the massage table. I also use several different therapy guns. Those are becoming very popular out there. Hyperice has a good one. Theragun, who kind of started the whole craze with therapy guns. They have one of the better ones. I use that as well. It depends on what the patient needs. I don't use them on every patient. I don't.
What are maintenance cases?
Okay, great question. Maintenance cases are where people have reached a certain level in their care, and they can't undo some of the damage that has happened to their body for many years. We all get older. We're fighting gravity every single moment of every single day of our lives. So some people have arthritis that can't be undone. Some people, we have patients that come in, they've had surgery and that can't be undone. And that is going to forever hinder the ability of their body to move as it has in the past and in our younger years. So what we will do is we will look at a patient and we'll explain to them how far we can take them. And so there will be a goal there, and we'll say, okay, this is obtainable. And once we reach that goal, then the patient turns into what we call a maintenance patient, is where we want to keep them there and sustain that stability in their body for as long as possible. My favorite area of the body is the pelvis. When there's biggest, thickest, strongest areas of muscles in the body are around the pelvis, and the pelvis is smack dab in the middle of our body. So when that goes into distortion, it causes a ripple effect above and below. So it can go into certainly into our spine. It can go into our shoulders. It can absolutely go into our neck and into our cranium. I see it all the time in a person's pelvis. is what we call obliquity. So the pelvis, actually I have a pelvis right here. I'll show you. So when the pelvis goes into this direction, and you know that the person standing in rotation, you can imagine what their knees are going to look like. All I have to do is look down, and you'll find that one knee is bent, one knee is hyperextended because they're standing like this. If they were to be standing and have a right rotation in the pelvis, well, you would see a hyperextension and a bent knee on opposite knees. That's also going to go down into the feet. So you'll find that one foot will have a collapsed arch, the other foot you're going to be walking on the outside of their foot. So the body is first and foremost a mobile unit where you have to try to balance stability and mobility. Your question of becoming a maintenance patient goes all the way back to the foundation of what neurosomatic therapy is, and it's an assessment of the individual in front of you to know exactly what the goals of that patient are, their medical history. That's another thing I should probably just throw out there. We really look at a patient's medical history. Your average massage therapist does not, especially in a spa setting. They know very little, if anything at all, about the medical history of the patient. They don't even call them patients most of the time. And they certainly don't read X-ray reports or know how to look at imaging. Neurosomatic therapists have incorporated through the Center for Neurosomatic Therapy classes where we actually learn how to I wouldn't say go so far as to say, we have like a degree in radiology, which my father has from University of Syracuse. He was a radiologist. But we get a crash course, so that otherwise the school would be too long. But I tell you, in the amount of time that it takes to get certified, we learn a lot. And one really important part is to be able, when a patient comes in and they're already injured, they have a herniated disc, they have bulging discs, fractures that are recent or even current. A lot of people come to us and I treat same as a physical therapist would. Our work is very close. The rehabilitation side of my work is very close to what physical therapists can do. So that's another part of it, is that I do have a lot of patients that I treat that are currently injured, and I'm working with them to get on the other side of that so that we can get them to a point of stability and then call them a maintenance patient. If I had it my way, there's the very little of the industry would be about the spa life, where you go on Google and there's just all these massage places that have that, and but you go on Google and you would find a lot of private practices for neurosomatic therapies. That's primarily about pain relief, pain prevention, dysfunction, sports and medical massage.
How can the community contact you?
I love to just talk and just give information out there anyway, but if people do want to experience this, if they're interested, they can contact Woodlands Chiropractic. It's located in the Palm Harbor area, so kind of north of Clearwater. And then I'm in private practice in the St. Petersburg area, and people can contact me directly. They can call me at 727-422-2254.
Well, thank you. It's been a very educational time well spent.
Yeah. Lovely talking to you, Kim. Thanks for giving me this opportunity, and you are definitely one of my faves. I love treating you. I love working on you, and thank you for helping get the word out there.
Well, great. I'm definitely not going to edit that part out. So, so to the community, thank you for spending your time, and I'm looking forward to doing another interview. But be sure to give Jay a call, because I can personally attest that he has an amazing qualities about treatment that you will not find anywhere else.